Hi everybody, welcome to Doc Simple. I'm Doc Ben.
And I'm Doc Leo.
Today's episode, head injury in children.
Before we get started with this particular subject, we want to refer you to our adult head injury topic video, which we discussed at length. For any kids that are teenagers and adolescents who have had injuries, we'd have similar recommendations for that. We're going to be focusing primarily on the very young in this particular episode.
Right. Okay, so let's say, Leo, my 18-month-old rolled down the stairs and was crying and I don't know what to do. And of course, little Billy, that's not my kid's name, doesn't speak yet.
Yeah.
Or doesn't speak clearly.
Sure.
What do I do with that?
Well, first of all, that gives me palpitations.
Yeah.
Just kind of thinking about that. We both have kids, and we totally understand the fear and the terror associated with that experience. Whether they fall off a chair or roll down the stairs, which they tend to do, it's scary.
Right.
We want to focus in on what the assessment needs to be for those children and how we do that.
Okay. So the symptoms, of course, for especially nonverbal children would largely be activity. Are they acting more or less normally or not? And then certainly any vomiting.
Yeah. What we usually say, do you feel like your child is being themselves? Right? If your child's acting like your child normally acts, that's a very reassuring concept to us. If you feel like your child is certainly not acting like themselves, or if they're not moving an arm or a leg, we get pretty concerned about that.
Of course. Okay. What about loss of consciousness? That's a big one that comes up a lot.
Yeah. So with any head injury, adult or children, loss of consciousness is concerning. It suggests that the head injury was intense enough to have caused loss of consciousness and would warrant an evaluation by a physician. And we would recommend that evaluation to be in the emergency room.
That's right. I'd agree with that. Right.
Yeah.
Okay, so now we're talking about treatment. Now, the good news is the treatment at home is pretty limited. It's more or less monitoring. So if you think everything's okay, you feel comfortable staying at home watching your child for a little bit, there's really nothing else to do, perhaps decreasing their activity, fine. And then over-the-counter medications like acetaminophen could help with pain. Okay. Yeah. Expectations and prognosis. Now, depending on the child's age and the intensity of the injury, we're talking hopefully not more than a couple days of symptoms. All right, Leo, I had one question that comes up quite a bit in the emergency room. Do I have to wake my child up throughout the night?
No, I would say if your child's had a minor head injury and you feel like you don't need to come to the emergency room with the child, then you do not need to wake your child up.
Whew.
Yeah.
Okay, so let's talk about who to call, where to go. The bottom line is, if you're a parent or have a child, especially a young child that's injured their head, and you have any level of concern, you of course can come to the emergency room and we can evaluate. Now, the thing you must remember when coming to the emergency room, the benefit you're deriving from that visit is the doctor's assessment. That doesn't necessarily equate to CAT scan. Would you agree with that, Leo?
Absolutely. In fact, one of the primary goals for us is try to avoid doing CAT scans on children because of the radiation exposure associated with CAT scans. Sometimes we'll assess the child and find things that are concerning and do a CAT scan right away. And in that scenario, we think that the benefit of the scan outweighs the risk of radiation exposure. Other times we may want to watch your child for some hours and make sure that he's doing okay, he's able to drink, and starts to act more like himself. And in other circumstances, when it's very minor, we might just say everything looks good and we think you can treat this at home.
Okay, so that's our episode on minor head injuries in children.
Thanks for watching us on Doc Simple.
I'm Doc Ben.
And I'm Doc Leo. Please like us and share us.